Welcome to the explainer that is, frankly, about to become your absolute ultimate cheat code. Look, if you're staring down day one of your pharmacy technician certification exam study plan right now, and you're feeling completely overwhelmed by the sheer, massive volume of drugs you have to learn, take a deep breath. Seriously, you're in exactly the right place. Today, we're taking the single most intimidating part of the PTCE, and we're breaking it down into a strategic, highly visual, and actually manageable system. We aren't just going to study today, we're going to learn how to literally hack the exam using pattern recognition. So here's our roadmap for the explainer. First, the medication domain. 2, brand versus generic naming. 3, the class-first strategy. 4, decoding common suffixes. 5, core drug classifications. And 6, applying your knowledge. Let's get right into it. Section 1, the medication domain, conquering the 35%. Okay, let's dive into this by understanding exactly what we're up against here. When it comes to the PTCE, not all topics are weighted equally. If you want to study smart, you really have to follow the numbers. As of the newest exam update, the medications domain makes up a massive 35% of the entire test. That's the single largest slice of the pie, far outweighing federal requirements, patient safety, or order entry. So this naturally commands our immediate attention. If you master this domain, you're already well on your way to earning your certification. But here's the trap that catches so many test takers: treating the study guide like a phone book. If you're sitting there right now trying to memorize an alphabetical list of 200 drugs through sheer brute force, you're gonna burn out. It's frustrating, it's inefficient, and honestly, it's entirely the wrong way to study. The PTCE doesn't expect you to be a walking medical encyclopedia. It expects you to recognize patterns. Moving on to Section 2, brand versus generic naming. Making the connection. Take the brand names Zestril and Prinavil. Notice how they're capitalized? That's because they're trademarked names created by pharmaceutical companies. Now compare that to the generic name, lisinopril, which is written in lowercase. This is the actual active chemical ingredient. The exam will frequently test your ability to match these up. A really key takeaway here is that a single generic drug can have multiple brand names, but the generic name, that's the constant truth you need to anchor your knowledge to. Section 3. The class-first strategy, your cheat code. So, since rote memorization is completely out, what's the alternative? I want to introduce you to a highly effective method from our source material called the class-first strategy. Grouping drugs fundamentally changes how your brain actually stores the information. Instead of treating every drug as some isolated fact, you follow a 3-step logic chain. Step 1, group the drugs by their broad therapeutic class. Step 2, associate that entire class with the condition it treats. And Step 3, connect specific generic and brand names into that pre-existing mental bucket. Let's look at how this works in practice. Let's use statins as a concrete example to prove exactly how this pattern recognition is going to save you so much time. You don't start by memorizing atorvastatin. You start with the class, statins. What do statins do? They treat high cholesterol, right? Once you've locked that connection in, then you just drop the specific drugs, like atorvastatin, which is Lipitor, and simvastatin, which is Zocor, into that category. Now, if the exam asks you about a statin you only vaguely remember, your brain already instantly knows it's for cholesterol. Section 4. Decoding common suffixes, the secret language. The medical field actually gave us a massive gift when naming generic drugs. They created a secret language. And once you know it, generic endings immediately give away their class and their overall purpose. These suffixes act as highly visual cheat codes, particularly for cardiovascular medications. See the ending -PRIL? That immediately tells you it's an ACE inhibitor, like lisinopril or enalapril. Spot an olol? That's a beta blocker, like metoprolol. And of course, statin gives away the statins. If you see a generic name you don't instantly recognize on the test, checking its suffix is absolutely your best strategy for narrowing down the answer. And this pattern holds true across almost all body systems. In gastrointestinal meds, Prazole points straight to proton pump inhibitors, like omeprazole. In mental health, PAM or LAM signifies benzodiazepines, like diazepam or lorazepam. And for anti-infectives, thromycin flags macrolide antibiotics, like azithromycin. Locking these specific patterns in is going to save you on countless exam questions. Section 5, core drug classifications, understanding the why. Recognizing names is really only half the battle, though. To totally secure that 35% of the exam, we need to shift our focus to understanding the underlying mechanism and the primary use of these foundational drug classifications. This brilliantly illustrates why class knowledge is just so powerful. Compare two different cardiovascular classes, ACE inhibitors and beta blockers. Both are used to treat hypertension or high blood pressure, but look at how they do it. ACE inhibitors work by relaxing the blood vessels. Beta blockers, on the other hand, slow down the heart rate to reduce the workload on the heart itself. The PTCE loves to test if you actually understand these different physiological mechanisms for treating the exact same condition. Now let's look at a really vital mental health classification, benzodiazepines. Remember our suffix trick? These end in PAM or LAM. Their mechanism? Well, they enhance GABA activity in the brain, which basically causes a calming effect. That mechanism tells us their primary use, treating anxiety, panic attacks, and sometimes even seizures. But as a pharmacy technician, safety is absolutely paramount, so you must also associate this class with their critical side effects, specifically sedation and the high risk of dependence. The true beauty of this framework is that you literally don't need deep doctoral-level pharmacology knowledge. The source material emphasizes that you just need the ability to make connections between names, uses, and classes. That's what pharmacy logic is all about. Once you know a beta blocker reduces heart rate, you can confidently eliminate any multiple-choice answer that suggests it treats, say, a bacterial infection. Section 6. Applying your new knowledge, contextual deduction. Okay, let's talk about the actual test environment. The PTCE rarely asks straightforward flashcard-style definition questions. They heavily prefer contextual, scenario-based clinical problems. You kind of have to deduce the answer. Here's a perfect example of how it appears on the exam. A patient is taking an ACE inhibitor for hypertension. Which drug fits this profile? Notice how this cleverly tests your knowledge of both the drug class and the indication simultaneously. It's not just asking, what is lisinopril? It's giving you the clinical scenario and asking you to work backward. Let's do some active recall right now to test your newly acquired pattern recognition skills. Here is a direct question pulled straight from the study guide. Which of the following is the generic for the brand name Zocor? Is it A, atorvastatin, B, simvastatin, C, rosuvastatin, or D, pravastatin? Take just a second to think about it. Well, if you guessed B, simvastatin, you are spot on. Notice how relying on the statin suffix doesn't immediately give you the answer here, simply because all the options were statins. This is exactly where you rely on your specific brand generic pairings within the class. Zocor pairs with simvastatin to treat hyperlipidemia. Let's hit you with a second mini quiz. This time, we're focusing on identifying the correct class from a mixed list of generic drugs. The question is, a patient is prescribed a statin to manage hyperlipidemia. Which medication belongs to this class? A, metoprolol, B, lisinopril, C, atorvastatin, or D, furosemide? Use your secret language. The correct answer is C, atorvastatin. And let's break down exactly why using the suffixes on those distractors. Option A is metoprolol. The OLOL tells us it's a beta blocker. Option B is lisinopril. The pril means it's an ACE inhibitor. Option D, furosemide, is a loop diuretic. Because you know the visual cues, atorvastatin, with its statin ending, is literally the only logical choice. You deduce the answer in seconds. I want to leave you with this really encouraging quote directly from the study guide. You don't need to know everything. You need to know the right things well enough to think like a certified pharmacy technician. This is a massive mindset shift for a lot of people. Stop trying to memorize the whole dictionary. Start focusing on strategic thinking, high-yield categories, and the visual shortcuts that professional technicians use every single day in the pharmacy. So, as you wrap up day one of your study plan, I really just have one question for you. Are you ready to stop reading the phone book and start truly hacking this exam with pattern recognition? Take these tools, the class-first strategy and the suffix secret language, and start applying them to your flashcards today. You've got this. Keep studying smart, and I will see you in the next explainer.